In most cases, applicants have to decide which nurse practitioner track they are applying for at the time of application. Deciding on which nurse practitioner track can be very crucial for your career. So in this episode, I'm going to talk about 4 elements you should consider when you are deciding which nurse practitioner track is suitable for you.こんにちは。アメリカハワイ州でファミリーナースプラクティショナーをしている三浦美希です。私はもともと日本生まれで日本育ち、日本で性看護師として働いてから25歳の時にハワイでナースプラクティショナーになるために渡米しました。もともと留学生として渡米して仕事を通して自力でアメリカ永住権を取得。今では10年間ナースプラクティショナーとして産婦人科領域で働いていて、2024年には州ごとに1人しか選ばれない臨床で優秀なナースプラクティショナーとしてアメリカナースプラクティショナー協会から賞を受賞。また Hawaii Association of Professional Nurses からはリーダーシップ賞も受賞しました。これまで留学アメリカでキャリアアップすることにとっても苦労しましたが、その甲斐があって今では経済的に安定して仕事もプライベートも充実した生活を送っています。私のようにアメリカで看護師、ナースプラクティショナーとしてキャリアアップをしたい方を支援するために JNP プロジェクトを立ち上げました。この事業では看護留学のコーチングをはじめ、看護師やナースプラクティショナーとしてのキャリアアップの秘訣を実体験のもとにシェアしています。キャリアだけじゃなくて満足した人生を送りたい人の夢を心から応援しています。ぜひチャンネル登録、そして当プロジェクトのウェブサイトも見てください。では今回のエピソードに行きましょう。So in this episode, we're gonna talk about 4 elements you should consider when you are deciding which nurse practitioner track that you want to get into. First element you should consider is doing market research.I mentioned this in the previous episode, but there are more nurse practitioner programs exist in the United States these days. So that means that there are many graduates and nurse practitioners with experience looking for jobs. Depending on the city, states, or depending on the specialty, finding jobs as nurse practitioner can be difficult at times. And to have a successful nurse practitioner career, you want to make sure not only to graduate nurse practitioner program successfully, but to be able to find ideal job for you. So you should ask yourself, are you flexible with where you live? Are you willing to move at least for a short period of time? Or do you want to stay in the state or city that you're currently in? Or do you have any particular state or city that you want to live in the future? If you have a specific state or city that you have in your mind that you want to live in, you want to do job market search and see what kind of nurse practitioner jobs are available, what's the need for nurse practitioner in that specific community. Like I said, you want to make sure that there will be a lot of job opportunities awaiting for you when you graduate from a nurse practitioner program. For example, initially I wanted to become a pediatric nurse practitioner because pediatrics was my passion. I had pediatric nursing background and it was natural for me to get into pediatric nurse practitioner program which existed in Hawaii at the time. And I also knew that I really want to stay in Hawaii. I didn't want it to move to anywhere else. Now, when I was considering applying for different nurse practitioner programs, I can't remember who told me this, but somebody told me that there are very limited job opportunities for pediatric nurse practitioner in Hawaii at the time. And I am so glad that I got the information because that turned out to be true, at least for that time being. Because I know multiple pediatric nurse practitioners who couldn't find jobs as a clinician, and whether they worked as a faculty and teaching nursing students, nurse practitioner students, but not have clinical jobs. Or my friend who was a pediatric nurse practitioner but couldn't find a job and went back to school to become a family nurse practitioner, so she was able to find a job in Hawaii. But anyway, when I was considering of applying for nurse practitioner programs in Hawaii, I got the information and I decided, you know what, I'm gonna go into family nurse practitioner program because with the family certification, I can still see kids, I can still see the pediatric population if I want to. But with the family certification, I have way more job opportunities. So this is the way to go. And I'm so glad that I did. As some of you may know, I end up going to women's health because my first job was at an OB/GYN office and I end up loving this specialty and I've been practicing in women's health for about 11 years. So it all worked out. So if you are particular about where you want to live, where you want to stay, you want to do a job market search and see what kind of nurse practitioner jobs are available in the community. And I think it's better to have a broader scope of practice than narrow ones in terms of looking for jobs. Because like I did with family nurse practitioner certification, I was able to gain more training specific to women's health after I graduated. So I became an expert in the field. Especially if you are international nurses on student visa, finding jobs is very critical. Because you have only 1 year to find an employer who can support you to get work visa or permanent residency through work. So job availability, marketability is so important, particularly for you. Second element to consider is your interest. If you are okay with living anywhere, but you are very enthusiastic about going to dermatology, then you should get into family nurse practitioner program or adult gerontology primary care program. But I will probably suggest family nurse practitioner program because with the family certification, you can also see kids. So wider population you can see, you're more marketable. So you have to choose whether you want to prioritize your clinical interests or where you want to live. If you are, let's say, very much interested in women's health and you also want to stay in Hawaii, it is not impossible for you to find a women's health job in Hawaii. But just to know that there are certain fields that are more competitive to find jobs among nurse practitioners. And for example, women's health is very popular field for nurse practitioners, and it can be very competitive to find a women's health job in Hawaii, for example. So it's not impossible, but just to know that you may have a little difficult time to find your ideal job.Particularly as a new grad nurse practitioner.
今回のエピソードをお話しする前に素敵なお知らせがあります。英語を使って患者さんと接するすべての医療者のために作られた実践的な医療英会話のコース、医療英語101、患者さんから信頼されるための医療英会話のコースが開講されました。このコースはアメリカに留学、移住、そしてキャリアアップしたい方も含め、日本で医療を提供していて、英語をしゃべる患者さんとよりいいコミュニケーションを取りたい方のためのクラスです。このコースでは、よりプロとして信頼されるための英語のフレーズだけじゃなくて、アメリカの文化をよく知ることで、いろんな場面に対応できるプロとしての医療英語を教えています。アメリカに何年何十年と住んでいても、またパートナーがアメリカ人であっても、一見ペラペラと英語が喋るように見えても、ちゃんと医療英語の基礎を学ばないとプロとして信用される医療英会話はできません。私はアメリカで大学院を出て、そしてナースプラクティショナーとしてアメリカで10年勤務してきて、このプロとしての医療英会話の方法を身につけました。そしてアメリカのナースプラクティショナー協会から優秀な臨床実践を認められて賞も受賞するようになりました。これはやっぱりただなんとなく手探りで英語を喋っていただけじゃなくて、医療英語の基礎をきちんと学んだからだと思います。よりいろんなキャリアアップのチャンスをつかみたい、患者さんからより信頼されたいという方は、ぜひこのコースを取ってください。まずは無料でレッスン1を体験できますので、下のリンクからぜひ申し込んでください。では今回のエピソードに行きましょう。
Third element is to get feedback from nurse practitioners in the same nurse practitioner track. If you're interested between family nurse practitioner certification and adult gerontology primary care certification, look for opportunities to talk to nurse practitioners with these certificates and ask about pros and cons of getting certain certifications. For example, if you compare family nurse practitioner certification and adult gerontology primary certification, some may say FNP is better because you are more marketable, because you can see different populations. Others may say adult gerontology primary care certification is better because they can more focus on certain clinical fields and they're not intent to see kids at all, so that works for them. Or if you ask me, I'm very interested in women's health. Should I go into women's health nurse practitioner program or family nurse practitioner program like you did? And I may say there are pros and cons of both options. Like I mentioned earlier, I have family nurse practitioner certification by being working in women's health for 11 years. And I love practice women's health and I don't plan to change my specialty anytime soon. But there are definitely pros and cons of choosing different tracks. For example, for pros of going to women's health nurse practitioner program, the program really focuses on women's health. So by the time you graduate, you can be very confident with your skills. With family nurse practitioner program, you have to learn different fields, adult medicine, even behavioral health, or gerontology, pediatrics. So you only have one semester to learn about women's health. So by the time you graduate, like I felt very unprepared to practice in women's health. And that will be a con of going to FNP program. But in the end, it worked out for me because for my first job, I was looking for employer who is aware of my skill level and can teach me even with a lower wage or salary. And I learned so much from my first employer or boss. Through my work experience, I became competent in women's health. So though my FNP program didn't really prepare me well enough to be independent provider in women's health right away after graduation, it did work out for me. With that being said, con of going to FNP program is because you learn so many different fields, you might feel unprepared by the time you graduate because you just learn little things in different fields, but you might not have deep knowledge and skills in certain fields. On the other hand, one of the pros of going to FNP program is that I can be PCP for my patients that I see in women's health, which actually happens quite often. And I also provide urgent care services like seeing them for flu, COVID, or some minor injuries and so on. With my FNP certificate, that's well within my scope of practice, and I also feel well prepared to provide that care. And another benefit of going to FNP program is that I feel more marketable. If I happen to have to move to some other states, or if I happen to lose my job and I'm really desperate to find a job and look for a job other than in women's health, so I have more job options and feel more marketable. And in fact, as a side job, I sometimes work at urgent care, and that's because I have family nurse practitioner certificate. So talking to people who have different nurse practitioner certificates really help to see pros and cons of each nurse practitioner track. Fourth element you should consider is to shadow nurse practitioners in the field. The best way to figure out which clinical field really match you is to actually shadow nurse practitioner in the field. Everything comes with pros and cons, and you can find out cons of being in a specific specialty, which might not be apparent until you do shadowing. With that being said, finding a place that you can shadow can be very difficult because of the HIPAA, because of infection control. And a lot of nurse practitioners are already spread thin teaching students. If you do have opportunity to shadow nurse practitioners, you should go ahead and take that opportunity. I hope this episode was helpful for you. If you like this episode, please give me a thumbs up and make sure to subscribe to my channel. We upload a new episode every week. Also, if you have any requests for future episode, please write down in a comment section. Alright, I'll see you in the next episode. Aloha!